Hi and welcome to Azul Medspa. We've created this short clip just to be able to give you information regarding your Botox treatment for today. Hopefully answering questions that are commonly asked during the procedure. This will also help shorten the time during your procedure so that we can address the actual treatment and not spend a lot of time talking about information that could be addressed in this video. So we're going to begin with before your treatment. The thing that we recommend is to minimize the chance of bruising if you can refrain from taking any medications that thin your blood. So examples of these medications over the counter would be ibuprofen, Motrin, Advil, Aleve, any medication that contains aspirin, to include Excedrin, and of course alcohol intake. This will help minimize the chance of bleeding, which in turn results in bruising. So if you can prepare, it'll better your results. During the procedure, common questions that are asked are, will there be any redness or swelling or bruising? That is always a possibility when we introduce a needle to any part of the body. What's important is that it's very short-lived. It will subside shortly after your visit, doesn't linger for too long. Also, another thing is how long till you see results for Botox. You can see Botox results in as little as 2 to 4 days. Just depends on the person, but Botox is actively creating results in the treatment area for up to 2 weeks. So it just depends, anywhere from 2 days to 12 days. Also, how long did the Botox last? It varies per person because it is a product that's being metabolized. Your body's breaking down and getting rid of the effects. So usually about 4 to 6 months average person. Things that do affect the pace of it is if you live a very active lifestyle, if you have a fast metabolism. The Botox can wear off in as little as 2 to 3 months. So it just depends on the person and your lifestyle. And then post-treatment care. Those are things that we definitely want to make sure you do in order to get the best results from your treatment. So with that being said, it's important for you to refrain from laying down immediately after your treatment. For a total of 4 hours, you want to stay in the upright position, so don't go lay down as soon as you leave the clinic. As far as 24-hour restrictions, we ask that you don't partake in any strenuous activities, so no exercise, no sports, no excessive bending over, forward. All of these things are precautionary restrictions just to make sure that the Botox stays in the area where you've received the treatment and it is absorbed into the proper muscle without varying in any other area where we don't want results. And then also, in addition to the 24 hours, as I mentioned, for bruising, the medications that we want you to refrain from taking 2 weeks before your treatment, if possible, we also want you to stay away from for at least 24 hours after your treatment. For the same purposes, to minimize bruising. So again, ibuprofen, Motrin, Advil, Aleve, aspirin, Excedrin, and alcohol intake. Do not consume for 24 hours. If you have any pain or discomfort after your treatment, sometimes it's common to feel a little boggy in the head or feel like you're going to get a headache. That is totally normal, but you can take Tylenol to help that discomfort subside. So if you want to take over-the-counter Tylenol or over-the-counter extra-strength Tylenol, that is the go-to medicine for the 24-hour period. And then last but not least, as I mentioned, the Botox lasts actively for about 2 weeks. So during that 2-week time frame, we don't want you to manipulate the treatment areas. So examples of things we don't want you to do is do not go get a facial, do not go get a chemical peel, a massage, microneedling, anything that's basically causing manual manipulation to the treatment area. So you want to make sure that you follow these guidelines. Make sure if you have any questions during your treatment, I can definitely clarify or reiterate. But hopefully this video provided enough information so that we can get through your treatment and you can be on your way to your daily activities. Thank you, and we'll see you in a minute.